All right, we're going to get started. So this next panel is, as folks know, there's a new National Academy of Medicine collaborative on decarbonization, and we've been really excited by all the work by Healthcare Without Harm and other partners in the space on decarbonization of healthcare. And so I'm excited for this panel. I'd like to introduce Emmie Mediate. She's the U.S. Climate and Health Program Director at Healthcare Without Harm and supports the healthcare sector in tackling climate mitigation and resilience while advancing climate smart policy. And she'll introduce the rest of our speakers.
Hi, everyone. Good afternoon. And thank you for those of you who are joining us here as well as remotely. I'm really excited for this session on decarbonizing the healthcare sector. We've talked a lot about emissions generally and a lot of times looking outwards to our transportation, to other sectors. And this panel is going to be a chance for us to look inwards a little bit at our own emissions in the healthcare sector. So I'm going to provide just really quick framing for the conversation that we're going to have, and we're really lucky to have 3 different experts here that I'll introduce momentarily. But just want to provide some framing. As Lisa mentioned, there's a lot of momentum that we're seeing in this space recently, increasing momentum and new action that's really very exciting around addressing healthcare emissions and building resilience and the role of the healthcare sector in that work. One of the sort of kind of key pieces of that movement that Lisa mentioned is that NAM collaborative that's happening, where we're seeing leaders from across the healthcare sector coming together to spur action. A couple other pieces I wanted to provide context around to frame that in addition to NAM. One of those is the Health and Human Services Healthcare Sector Pledge that kind of launched last year and recently reopened, which is really exciting. This is a pledge that healthcare organizations can sign to commit to reducing their own emissions and to building resilience. More than 800 hospitals have signed on so far. And with the recent reopening, we're hoping to see many more. So that's another just sort of signal about how there's this momentum in the sector happening around climate action. And then the third, which I think is near and dear to all of our hearts, is just the role of health professionals that we've seen in advocating within their own healthcare hospitals or centers or wherever they're working, advocating internally for action from those healthcare organizations as well. So between NAM and the pledge and the momentum from health professionals, we're seeing a real groundswell of movement, and it's a really exciting time to be in this space. We're going to spend the next 45 minutes or so talking a little bit more just about what's happening in this space, ways that all of you can get involved, and really hearing from some experts around what this work looks like for decarbonizing the healthcare sector. So with that, I'm going to introduce our 3 panelists here and invite them to join me on the stage. I'll start with Dr. Brian Chesebro, who is joining us. He is a practicing anesthesiologist from Portland, Oregon, and also serves as the medical director of environmental stewardship for Providence Health. We're really, really lucky to have his expertise in the room here today, and I know he's well known to many of you as well. Secondly, we have Dr. Katie Lichter, who is a resident physician at the University of California, San Francisco's Department of Radiation Oncology, and she's also a climate health fellow at UCSF. So really good to have Katie with us. And then finally, last but certainly not least, we have Joe McCannon, who is joining us. He works at the U.S. Department of Health and Human Services, Agency for Healthcare Research and Quality, in support of standing up the department's new Office of Climate Change and Health Equity that we'll talk a little bit more about today. So I'll have everyone join me here up on stage, and I'm going to ask my panelists or speakers to come up to this podium when it's their turn to speak. Let's get it started. And we're going to hear from Katie first, so I'll invite you up.
Well, thank you for having me. I appreciate the introduction, and I'm honored to be with these other speakers here today. So I'm going to talk about decarbonization of the healthcare sector from a resident and a trainee perspective. Sure. So just to give context to my discussion today, going to jump in with my story of decarbonization. So it was 2020 and I was a tired, burnt out intern, finishing up a night shift. And I was walking home, and those of you who are coming from the Bay Area or from the West Coast may remember the day the sun never rose. And as I walked home, I was tired and frustrated. A cancer patient that I was caring for was admitted. They had had progression of disease despite being on chemotherapy and radiation, but unfortunately could not access their own clinic in Northern California due to the wildfires. As I got home, my partner and I, who had moved to California recently, very excited to live more sustainably, to live the California lifestyle, we grabbed our sustainable grocery store bags. And as I ripped off all the PPE that I had put on that day, I thought there must be something more that I can do in my own hospital, in my own setting. So that gave me the framing of how I think about it as a resident, as a trainee. And I've thought about it in 3 questions. 1, how does climate change impact cancer care in my patients? 2, how does cancer care impact climate change? How are we contributing to this? And then 3, how can we organize together to inspire the change that I hope to see? And I think this really relates to 3 terms that a lot of us in this room are very familiar with: adaptation, mitigation, and advocacy. And that's really how I frame decarbonization. So I'm just briefly going to touch on adaptation. I know this is different than decarbonization, but I do think, oftentimes people ask me, are you an adaptation person or are you a mitigation researcher? And I think it's really important, especially as a trainee and as a physician, to be able to engage in both and to talk about both, because really that's been the selling story to engage more oncologists. So from the adaptation lens, in terms of understanding how is climate change impacting our patients, we started with 3 things. And I guess also taking a step back, in one of the things too, I'm just going to jump back here to this slide, that one of my mentors from PSR in San Francisco really challenged me to do as I entered this space as a resident, to not only think about these questions in terms of, you can be a resident who does a QI project and make sure it doesn't go off into the ether. But as a resident, think about how can you impact your department, your institution, your specialty, and even healthcare. So just jumping forward again, that's exactly what we did with adaptation. So right now we've been looking at UCSF. What do our missed treatment visits look like in the oncology department when there are times of wildfires? And then we expanded upon this and we looked at California and we mapped out, where have the wildfires been in California? Where are the radiation oncology clinics? Where are the cancer clinics? And then requested their data about missed treatment visits. And then we're building that out into looking at NCDB analysis to look at how does that actually impact outcomes? How does this impact our lung cancer patients? And really building that story to bring more people on. And then with so many residents interested in this space, we tried to lower the threshold, lower the inertia to engage in these projects. And we already had the survey questions. So how can we give co-residents who are in Texas, who are in Florida, Puerto Rico, how can we expand on this survey and have them ask the same questions and collect those missed treatment visits? So that's just a little bit about adaptation. As far as mitigation and decarbonization, we've been focused on 3 areas, and that's waste audits, life cycle assessments, really quantifying your emissions across a process from start to finish, and then conference emissions. And I'll talk a little bit about each one of these. So as far as waste audits, this was a really great spot to start as a resident. And we tried to keep that, how do we expand upon each one of these? So with waste audits in our department, we started as a resident QI project, really focusing on engaging the entire department. And what we were able to find is that we were able to, in making our methodology, create a 6-minute waste audit. We are only adding 6 minutes, and we were able to engage medical students in collecting that data as well. Once we built out the methodology, we did a baseline, and then we also created an intervention. And what we found, what we focused on was biohazardous waste, knowing that this has a larger carbon footprint. And what we were able to do is actually take our biohazardous, and although we wanted to reduce it by 30%, we were able to completely eliminate the biohazardous waste in our procedures in radiation oncology in our department, simply because we didn't understand what was appropriate red bag waste. So then we thought, can we take this from our department and expand it and think about doing something institutionally? And that's when we started focusing on education throughout UCSF in terms of making sure everybody at UCSF actually knew what should be going into red bag waste. After that, we were really excited and we worked with Stanford residents in our specialty to again expand upon this, lower the inertia and have more people work on this. So that's where we created the Waste Audit Toolkit. We actually created it within GME standards. And so this could be a QI project that other residents took on. We've been very excited to build this out. Now, 5 other residencies within radiation oncology are all working on waste audits and focusing on their red bag waste. But then we're also working with Climate Health Resources for Health Education, for those who are familiar, to make this more generalizable. How do we get it outside of radiation oncology? We're working with ENT folks and also ortho at UCSF to make it more generalizable. Next, this was a really big passion of mine, is if we want to decarbonize, we first have to understand where are we at today? What are our hotspots? What can we target? So that's been our life cycle assessment projects that we started within oncology. Within oncology, we again first started in our department and we figured out where our hotspots were. It was very evident very quickly, as we've seen within radiation oncology. A lot of this is coming from transportation. Actually, over 90% was coming from transportation alone. So how can we make changes? How can we focus on those scope 3 emissions? Well, being in San Francisco, taking a flight home, I quickly realized that there were a lot of options to focus on that patient transportation. We have to keep them coming into treatment every day. That's non-negotiable. But is there another way that we can target scope 3 emissions? And so we've actually been able within our department and starting at UCSF to focus on taking Uber Health and actually transitioning that to Uber Green. So that's making sure that all of our patients, which is about 25 to 30% of patients who utilize Uber transportation services, can actually be coming to clinic in clean cars, electrified cars. So we've been really excited to reduce our emissions in that sense, but then also take it from our department and think about expanding it to the institution. The last thing that we've been doing, again, really pushed by my mentors at PSR, is think about how can we expand this? How can we bring down that threshold for others to participate? So with our LCAs, we focused on not only getting data from UCSF, but getting data multi-institutional, actually also some global sites as well. So we worked with LCA experts such as Cassie, who's been a great mentor, Cassie Teal, on this project. And we focused on creating LCA templates that other people could do data collection, and then had, in this picture you can see, we had training sessions where we actually brought other institutions on. So now we're collecting data at 4 other US institutions and 3 other international institutions. Because again, how can we reduce emissions if we don't know where we are today and we don't know what our hotspots are? And then the last thing is a fun project, but I think is, always hits close to home. So as we started working on these projects, of course, being an academic institution, we want to go report on these. We want to share our findings at conferences. And we realized that that was going to have significant emissions associated with that, with in-person travel. But there also was a unique position because as I was entering this space, we were in the time of COVID. So all the in-person conferences transitioned completely to virtual, and then we're going to hybrid. And so what we did at every conference that we were presenting at, we also made a secondary, we submitted data and reported on what were the emissions pre-COVID, during COVID when we went virtual, and then hybrid. And with this data, and then also thankfully to ASCO, we were able to look at a large conference that has 40,000 people. And we're very excited. We are actually going to be launching here in the next 2 months an online calculator. What this calculator would do is not only take what we've started working and calculating doing, but an individual could log in and they could go to the conference calculator and say, hypothetically, I'm going to be coming from San Francisco and traveling to DC for this conference. What do my emissions look like if I'm going to go in person? But then second to that, what could I do in terms of lifestyle changes to offset my emissions? So just really trying to expand beyond collecting the data to actually getting folks to interact with this data. Not only can you log in as an individual, but we also made it so conference organizers could log in and could say, I'm going to be hosting a conference with this many individuals, and see if they allow for a hybrid option, what that would look like and what the potential reduced emissions would be for that. The last thing that I think that is very important in terms of decarbonization is the third piece, which is advocacy. So certainly all of this, has been the work of many other people beyond myself, which I think has been very important. And so I've been excited to move beyond that intern who was tired and burnt out with my reusable grocery store bag to launch a lab, which we call Green Health Lab at UCSF, and really launch this because I found there were a lot of medical students and a lot of residents who simply wanted to engage and they didn't know where to start. From this, also realized the importance of having organizing and having collaboration within my own specialty. So that's where we launched the resident climate health, equity, and sustainability team. And through these engaged residents, which is now over 30 residents, we were actually able to convince our professional society to launch a climate task force, which just launched on Friday, and we're in the middle of creating a policy statement. So we're very excited about that. But I think, when we're thinking about decarbonization, collaboration and organizing is absolutely key. And so I thank all of my partners in this. I'll hand it off to Dr. Chesebro.
Thanks, Katie. It's great to be here. I've never been to this meeting before, so thanks for inviting me to be here. And I can say it won't be the last time I'll be here. So far, this has been great. If tomorrow's like today, I'll come back every year. And my wife is a radiation oncologist, so I'm going to send her to. She's going to give you a call when you get home. So I just wanted to describe a little bit our approach in Providence on how we engage and empower clinicians across our health system to drive action on climate and health. And I'm a private practice anesthesiologist on my clinical days. On my non-clinical days, I'm fortunate to have a role with Providence as a medical director of environmental stewardship. And Providence is, for those who are unfamiliar with Providence, it's a large health system in the Western US, spanning 7 states, Alaska, Washington, Oregon, Montana, California, New Mexico, Texas. It's about 55 hospitals, over 1,000 clinics. So there's a lot of clinicians there to engage. And while we're all motivated here and we dedicate so much of our time to this topic, we represent a lot of colleagues who want to take action, and they just aren't quite sure the best way to go about it. We do know that clinicians across the board are engaged. They recognize the threat of climate and health, and they're motivated to take action. But these barriers amongst clinicians that we all represent and our societies represent have significant barriers. Number one, the lack of time. We are so busy taking care of patients and just trying to keep it all from falling apart, especially in the days now where we're incredibly short-staffed. And then there's a lack of knowledge. This is not something that I learned in medical school. Fortunately, the students going through training now do get dedicated curriculum on the intersection of climate and health, but most clinicians who are in practice now did not benefit from that education. So it's up to us to provide that for them. So how do you start to digest a problem as broad as climate change for a clinician who has very limited time? And they often come and say, what can I do? What can I do about this? I care so much, but what am I supposed to do? And so we broke it down into this matrix, and the pillars of action are familiar. You just saw them with Katie, right? mitigation, resilience, and advocacy. And those are the broad pillars that we work within and we recommend clinicians to engage within. We also have down the rows strategies of action. So there are different ways to address mitigation. There are different ways to address resilience. You can operationalize known best practice. There's a lot that we understand about what to do to decarbonize or to advance resilience or to advocate effectively. But there's a lot that we don't understand. And that's the second row, research and innovation. And then finally, the underpinning of all of it is education and engagement. And depending on the clinician, they may gravitate to one of those nine boxes, which represent tactical areas that they can focus themselves on with their limited time, but their vast amount of experience. So as clinicians, we often, and certainly in my role, I start when I'm thinking about change management in a large health system, I start from the perspective of trying to minimize environmental harm, right? Where the orange arrow is there. But we're within a health system. I don't have the benefit of talking to people like you all the time. I talk to people all over the health system who have vastly different priorities. And so it's really important when engaging those other stakeholders to acknowledge their priorities as well. And so I encourage the folks in our program to routinely apply this decarbonization value analysis strategy, and instead of just standing upon the platform of environmental stewardship, we really try to lead by example and prospectively address all 10 facets of value. And we quantify where we can quantify, but we speak to everyone in order to maximize engagement, take down barriers. It really helps us also in strategizing for change management to help us identify sticking points that we may not have otherwise anticipated. The best way to influence someone who doesn't share your priority is to acknowledge their priority, anticipate their sticking point, and gather data and quantify the impact of your change on their priority. And then you just see barriers coming down. And they're saying, well, as long as you're going to improve my priority, or at the very least not negatively impact it, then they'll go with you. So I'd encourage you to consider using this strategy as well. With that, I'm going to get out of the way and let Joe come on up.
Well, thanks, Brian, and thanks, Katie and Emmie, and thank you all of you for inviting me to be here with you today. I've been looking forward to the session, in part because I think we have some interesting information to share with you, but in part because I know I'll learn a lot from your questions and your experiences and your challenges. So looking forward to that part of things, and I'll try to get to that as quickly as possible here. I do just want to do a little bit of scene setting, though, to say a word about our office, the Office of Climate Change and Health Equity, this new office within the Department of Health and Human Services, and why we exist. And why we exist is the climate crisis and its impacts, both its acute impacts and its chronic impacts on human health. But we are not just the Office of Climate Change, we're the Office of Climate Change and Health Equity, because we also acknowledge that, like most public health issues in this country, there are certain populations who are disproportionately harmed by climate change, and that is due to decades of discrimination and disenfranchisement and underinvestment. And so we need to proactively meet the needs of those populations in the work that we do. It wouldn't be accurate to say that the Department of Health and Human Services hasn't spent several decades working on or thinking about climate change and its impacts on health. So the National Institute of Environmental Health Sciences at NIH has done some very important research. The CDC's Climate and Health Program has done important work at a regional and local level. And certainly the Assistant Secretary for Preparedness and Response, which is our agency that's responsible for responding to medical emergencies, has increasingly had to contend with climate-related catastrophes. But there's no single purpose-built entity within the Department of Health and Human Services that is focused on mobilizing this entire agency, this $1 trillion+ agency, to have all of its component parts focus on the impacts of climate change. And so that really was the genesis of this idea for the group that drafted it, some of whom are actually a part of your community. We now engage the Centers for Medicare and Medicaid Services, Food and Drug Administration, the Administration for Children and Families, the Agency for Healthcare Research and Quality, the organization that I'm a part of. All of these institutions that previously didn't sort of view this as part of their core work are increasingly doing so now. And that's critically important for the change we need to see in the sector and the change we need to see across the country. So with that as a backdrop, in its first week in office, the Biden administration called for the creation of this new office, asked the Secretary of Health and Human Services to stand it up. It was stood up in August of 2021, and it was situated within the Office of the Assistant Secretary for Health, Admiral Rachel Levine, who is a wonderful advocate for this work and has been very bold and insistent about its importance. This is the vision that we embrace as an office. Our goal is that within the next 5 years, communities and healthcare organizations that serve them are transformed such that every community and care provider in every U.S. geography is prepared for disruptive and chronic impacts on its most vulnerable populations. Every healthcare institution is prepared for long-term operation in the face of climate catastrophes. So we know that there are numerous disruptions associated with catastrophic events. We saw that, with the hurricanes this fall. There was a study that I can't stop thinking about that came out this fall, which showed that in the Atlantic and Gulf Coast regions, and I think in the 75 biggest metropolitan areas, something like, 25 of those have half of their facilities that couldn't withstand a Category 2 storm. So we have a lot of work to do there. We want every hospital and health system in the United States to publicly track its greenhouse gas emissions and be on a path to net zero by tackling Scope 1, Scope 2, and 3 emissions. That's really what we're here to talk about today. And we want public sector investments to reduce greenhouse gas emissions and fossil fuel dependence to address improvement of health and health equity. So anytime there's a new investment in an environmental project or program or investment in renewable infrastructure, it needs to think about the knock-on effects to health, and that's critical in our work too. And as I said, we want all of the operating divisions at the Department of Health and Human Services to be joining us and engaging in this work. We're a small office, so we really have to work through others in order to get leverage. That means working through these other agencies that I mentioned. It means working through federal health systems like the Veterans Health Administration, the Indian Health Service, the Defense Health Agency, and it means working with the private sector too in the National Academy of Medicine Collaborative that Emmie mentioned and in other venues as well. So to get started in our first 9 months as an office, what we tried to do to take the first steps toward that vision was first kind of make a declaration of intent. And so in November of 2021, we joined the COP26 health program, which basically committed the Department of Health and Human Services to develop a resilient and low carbon health system in Glasgow. That same month, the Department of Health and Human Services for the first time developed a strategy which explicitly has environmental health and climate related threats as a focus. And then a month after that, the administration issued another executive order 14057, which basically obligated all federal facilities, including federal health systems, to meet the administration's goals of getting to net zero by 2030, 2032, depending on the measure, getting to 50% reduction by 2030, 2032, and net zero by 2050. So that really kind of set the scene in terms of ambition. But of course, as soon as we said that, people rightly asked, well, what about the private sector? The vast majority of care provision comes from the private sector. How will you engage the private sector? So we created this program that you heard mentioned called the White House HHS Healthcare Sector Climate Pledge, which invited the private sector to match the administration's ambition on emissions reduction, to conduct scope 3 inventories, and to develop climate resilience plans that would target the needs of those most vulnerable in their surrounding communities. And in the photo here, you can see the group that was gathered at the White House in June to celebrate the first signees to that pledge. And now, as was mentioned, over 100 organizations have signed on, representing hospitals, health systems, suppliers, pharmaceutical companies, insurers, some very large organizations, some very small organizations. We think, a representative group, and one that we hope to build on by reopening that initiative. Our focus has been, in the subsequent 9 months since we launched that pledge initiative, has been to say, okay, it's one thing to make declarations, but those are just words. How are we actually going to take action and put wind in the sails of the healthcare sector stakeholders that are trying to make change? And it started with a national compendium of resources that we developed, which identified financing opportunities from Department of Energy, EPA, USDA, Treasury, many others, identified tools that we made available. We created a climate collaborative on cardiovascular health and climate change with the CDC. We launched a decarbonization primer at the Agency for Healthcare Research and Quality. Good initial steps last summer and this fall, but all of that, as great as it is going to be absolutely dwarfed by the Inflation Reduction Act and the opportunities that the Inflation Reduction Act creates for action in the healthcare sector. And that's something that, we're tremendously excited about. This historic legislation was, for people in the healthcare sector, was initially notable for the fact that it addressed drug prices, Medicare Part D, addressed the expansion of Affordable Care Act subsidies. But the closer you look at it, the more you realize that the tax incentives and grants and technical assistance opportunities for action on climate, for making investments in resilient infrastructure and renewable energy, are absolutely unprecedented and absolutely within reach of healthcare organizations of many different types and many different sizes. So our work right now is to act as a conduit to that legislation, or between that legislation and the healthcare sector, to say, these are the opportunities, the specific opportunities that are available to you. And we're working on digesting that right now in a really specific way. So you can say, for these facilities, these are the opportunities. This is when the opportunity starts. These are the mechanics of applying, really getting to that granular level of detail. And then we'll have accompanying web materials and webinar series that will support the introduction of those different provisions that organizations can take advantage of. Not enough, of course, just to disseminate information. So we'll also be working with groups and associations to make sure that these funds are not just accessed by the usual suspects, by the large corporations and large centers that are typically able to have the bandwidth to apply and understand the process of doing that. We want to make sure that these funds get to the communities that are most vulnerable, to the organizations that serve those communities in as expeditious a way as possible. So that's right at the heart of what we'll be doing in the months to follow here. So I'm going to stop there. I really welcome questions about that, but just finish where I started, saying thank you for the opportunity to be here, and with a request, which is, if you can encourage your organizations to sign the pledge, that raises the profile of what we're trying to accomplish, helps the urgency of our work grow within the Department of Health and Human Services, and in turn allows us to invest more resources in acting as a conduit to all of these opportunities from the Inflation Reduction Act. So if we can do anything to help you do that, it's in our interest, and it's in your interest, and it's in the country's interest. So we're very, very interested in doing that. So thank you again, and look forward to your questions.
Thank you so much to all three of you. No. I got a big. Hello. Oh, all right. Give you that one back. Yeah. Thank you to all three of you for that information. And we're going to open it up to questions as people are thinking of them. But in the meantime, I wanted to kick us off with a question specifically around how health professionals can advocate to healthcare executives or those in their institutions to encourage them to practice healthcare more sustainably, whether it's, doing a waste audit that Katie talked about, or addressing anesthetic gases, which I know is work that Brian's done a lot around, or the pledge that Joe talked about. What advice would you have for health professionals as they're encouraging their institutions to take action in large and small ways?
But you don't have a microphone. Well, if you don't have a microphone, you can't answer the question. I've talked to a lot of clinicians about how to get started and how to approach a problem and how to approach their group and kind of work, as Katie mentioned, kind of work within an expanding sphere of influence and opportunity. And you can start where you are, and pretty rapidly, depending on what role you have or what role you grow into, your sphere of opportunity or influence gets much bigger. But regardless of where you are and the change that you're trying to advocate for, I've always encouraged people to start first with an assessment of culture and working within the culture of your institution. For many people in healthcare, this is a new topic that they haven't really thought about. And if you kind of come into their office and start talking to them about it, they're like, well, what does this have to do with anything? And really grounding it in the mission and values of your institution within the culture gives you a common starting point that you can build from. From there, I think if you're going to propose a change, doing the homework and really assessing your practice, as well as assessing the literature and grounding your recommendation in evidence, follow it up with an assessment of your practice so that you can let your partners know the margin of opportunity at stake and give them a reason why they shouldn't go with you. And again, thinking beyond environmental stewardship, thinking about the total value analysis, using that term. I mean, I have mixed feelings using the term value, but it's one that a lot of healthcare executives understand. So it's important to use words that they understand and tie environmental stewardship as part and parcel with value in healthcare, and that's worked for us.
Yeah, I mean, I think you said it very well. Know the stakeholders and know what they're interested in. I think this is something that especially residents or trainees, medical students may be less familiar with. It's not something that we don't talk about stakeholders at medical school. But what we do talk about is know your patient and know where they're coming from. Know what's important to them. And so I always tell their trainees to think about it like a patient interaction. You're coming in it as a physician, and this may be a patient or a family, and their values, for example, coming into cancer care looks very different from what we're prioritizing as radiation oncologists. Think about it in the same way. What do they prioritize? And shift that narrative to meet them in the middle and see how you can explain this and how are we going to get to the same end goal with both priorities in mind.
That's great. Thank you. And definitely resonates, just using the language that I think others can relate to goes a far way. Thank you. Let's see what questions we have.
Okay. We have a question from Olivia. Their question is for Katie. Is the Green Health Lab mainly for medical students, MDs, or does it involve interdisciplinary work with other healthcare professionals? If not, are there plans for collaborations in the future? And they say, thanks for the talk.
Yeah, great question. It is very fluid and open to all. So we have had anywhere from actually a high schooler that was introduced to me from Lisa, all the way up to faculty who've been interested in being engaged, and it's been interprofessional. We have nursing students, we have public health students, numerous undergrads. Really, it's just a landing space, honestly, is that people want to be engaged and they want to take action. And lowering that threshold or that inertia and having projects that people can move into and having a community and having collaborators to work on has really been what created the lab. So interprofessional, open to all, and it's been very fun. Thank you.
Good question. Go ahead.
Hi, I'm Mariah Merritt from Baltimore, Maryland. My question is about healthcare equity, meaning the vision for everyone to have access to high quality healthcare. Are there any major top line kind of leverage points in the Inflation Reduction Act that are especially good for advancing healthcare equity?
The safest answer to that is probably. It is such a vast piece of legislation, and there's a lot in it. Let me just tell you sort of the major categories that as they relate to our work and what we're discussing here today. So the first category is investments in renewable infrastructure. The second category is investments in energy efficiency, or facilitating investments in energy efficiency. The third category is sort of transportation writ large, everything to do with greening transportation. The fourth category is resilience in communities. And that's where I think there might be an opening for what you're describing, because we have to understand that access to care is a part of the definition of a healthy community. And these investments in community resilience, flood resilience, fire resilience, facility resilience, health center resilience, particularly in indigenous communities and other communities that we know are at high risk, will probably create the opportunities for you're describing. And then the fifth area is facility resilience. So just thinking about facilities specifically. And then the sixth area is, I set myself up for this, supply chain. That small item. So that's a huge other area of opportunity.
Right ahead.
Hello, my name is Chetan Sarabu. I'm a pediatrician and clinical informatician from Stanford. And I've been trying to engage the informatics community to think about how to use the electronic health record and other informatics tools in decarbonization work and other climate change work. And so I was curious, from all of your perspectives and work in decarbonization, has that come up already in how the electronic health record and other digital health tools may be used? Thank you.
Can I answer that? Okay. I can tell you that using an EMR to gather clinically relevant data and pairing it with environmental impact data is transformative. Speaking as an anesthesiologist, people have known for years that anesthetic gases are potent greenhouse gases, but it's been difficult to manage that change amongst clinicians. People have done it through putting stickers on the machine or whatever. Our strategy leaned heavily on using the EMR and going in and if you want to manage change at an individual level, that outcome is the result of thousands and millions of individual clinical decisions summing up to a gigantic impact. So you have to gather the data at the individual level. The only way to do that is through the EMR. So we engaged Epic intensely around this. That's our EMR, and built a whole suite of anesthesia-related reports to drive clinical practice change to reduce that source of emissions. We also turned it then to look at nitrous oxide, which is another medical gas. People have known that that's presented a huge issue in healthcare. It's been very confusing about how to mitigate that. We've seen clinical practice shift away from nitrous, but the emissions haven't changed at all. And so we again turned to the EMR and said, well, what's going on? And we tied the EMR clinical use data with facility-based data, and then tied the clinical teams with the facilities teams and said, well, how much nitrous are we essentially pouring into the system versus how much is trickling out the distal end? And we discovered that the vast majority is lost. somewhere in this complex facility infrastructure. But that was a mystery until we went to the EMR. So in terms of mitigation, we're absolutely using it. In terms of resilience and community adaptation, we also are using it to identify patients and communities at risk in our during severe weather events. So we built within our EMR an automated communication lever. Essentially, when the heat index gets too high, it starts firing out to the primary care doctors and patients at risk, saying the heat index is about to exceed this threshold. Make sure you do this. Make sure you check on this. Make sure you know where your cooling centers are. Make sure you let people know where you are, because some of the highest risks are elderly solitary patients. So yeah, absolutely. It's like an untapped lever that I would love to talk to you about.
Go right ahead.
Hi, Kelly Dennings. I'm with the Center for Biological Diversity. I have a master's in public health, so not a MD. But this question is for Joe. We know women and gender diverse people are disproportionately impacted by climate change. So I was wondering if your group is working with the White House Gender Policy Council on this.
We meet probably every other week with the White House, and it's a constellation of organizations, which include the Climate Policy Office, the Center for Environmental Quality, the new OCEII, which I'm embarrassed, but I can't remember exactly what it stands for, but it is the office that's responsible for the implementation of the IRA, and it's the group that Senior Advisor John Podesta is responsible for, and you'll be hearing from. And so, what we try to do every other week is clarify our shared goals and make sure that we have representation from as many stakeholders as we can. We have within our office an Office of Environmental Justice, and that was stood up a little less than a year ago now. So they're at the table in some of these conversations as well. So the answer is, I don't think we're anywhere near as close to where we need to be in terms of centering all those voices in every single conversation. But, we do hold ourselves, I think, to a very high standard when it comes to saying, when we're talking about inequities in climate health, we're not just talking about one specific group. We're talking about Indigenous people. We're talking about communities of color. We're talking about LGBTQIA communities. We're talking about women. We're talking about elderly communities. We're talking about gender diverse communities where we don't have the luxury of sort of paying high level lip service to this. We have to really zero in on and understand the manifestations of these needs in different communities. And it's a three-dimensional challenge, because it's not as if we're dealing with one homogeneous climate problem, right? We're dealing with these different manifestations in different communities in different parts of the country. And so we have to understand those. So I don't know if that's a particularly satisfying answer, but it's very much what we're trying to do. And I think the work right now is figuring out how to do it well.
Thanks.
We have time, just maybe one more question. We can sneak in.
Okay, I'm Cheryl Holder from the Florida Coalition for Climate Action, and great presentations. Quickly, time when it took you to do some of these, like the residence program, because that's often what the pressure is when the residents are there for 3 years. How do you mobilize them to get it done? And that they take on the challenge. And before I forget, I'm with the NAM group in decarbonizing the health sector, and we sent out a survey across the country. So far, we've gotten 190 back. So I'm hoping that we can send it out while everybody's here and get your feedback. We want to hear from the community. This is the opportunity for the health sector to speak to NAM and get your opinions heard, because the recommendations will be coming down, but we really need the folks on the ground to do something. So that's it. I'll send a survey again to Beverly. Thank you.
Thank you.
Yeah, I think the question was on timing. Timing is always tough with students, residents. That's what we're all missing, even physicians. So I think as far as projects go, trying to expand on the sphere of influence and always trying to get more people involved. As far as these projects go, I always try to make sure that they're blocked into an academic schedule. So how do we start something and have a product by the end of the academic year? Or for medical students, same thing. We know that time is limited, so their second year, we got to capture them before they start doing, prep for STEP. So I think it's absolutely possible. It's amazing how far passion and collaboration goes. We all are very limited on that extra time. But I found, really by creating these teams, it does seem possible to get the work done. So.
Great. Well, thank you so much to all three of you for spending your time. And I'm just going to make a shameless plug. I know some of you are talking to members of Congress later this week. The Office of Climate Change and Health Equity is not yet funded. So there is a request to help them get funding. It's a work that we're doing at Healthcare Without Harm, requesting $5 million through congressional appropriations for the FY24 year. And we encourage you to advocate with that message as well in support of much of this work. With that, thank you to all of you for sharing your expertise, and please join me in giving them a round of applause.
Thank you all so much. And one other thing to mention is we are working once again with Healthcare Without Harm to come up with some templated letters to recruit our health advocate voice through our state clinician groups and through our medical societies to get more institutions to sign up. So hopefully we'll have that letter ready in the next few weeks. So look out for that.